Hello, everybody, and welcome to our latest community conversation here at Atlantic Health System. My name is Luke Margolis. I'm the Corporate Communications Director here at Atlantic Health. And today we have a little bit of a different layout. It's my pleasure to say that we have our first three-person community conversation happening in our studio, if you will. And so allow me to introduce our two guests for today. Seated closest to me is Dr. Damion Martinez. He is the Medical Director of Sports Medicine here at Atlantic Health System and is the team physician for the New York Jets. And next to him is Dr. Matthew Martinez. He is the Director of Atlantic Health System's Sports Cardiology program at Morristown Medical Center. Doctors, thank you so much for joining me today.
Thanks for having us.
Should be this is a great opportunity for us to do something that we have tried to do with this series before, and that's provide useful, actionable information for our audience. I'm going to give folks a moment to kind of get into the virtual room, if you will, and while we do that, I'll explain how this will work. For about the next half an hour, the doctors and I will have a conversation specifically about return to play, and this idea of returning to activity and as we coexist with COVID. But this is not just the three of us who will be involved. You have an opportunity to participate as well, so leave a comment in the thread, or you can post along with us, follow along, and we'll try to incorporate those questions and comments as we are able to. Know that if you have to tune out for some reason, or there's maybe a technical glitch on either our end or yours, you can catch the full version of this program both on our Facebook page or on LinkedIn, and we have it listed on our website, atlantichealth.org. You'll see it there in the Community Conversations tab. And then finally, if you prefer to watch this in more of a television experience versus on your computer, News 12 Plus is our TV broadcast partner. You will see that on weekends, Saturdays, and Sundays from 8:30 to 9, and you can check your local listings as to whether you're watching it on cable or on Fios or another provider. So that is sort of the run of show, if you will, the gist of where we are. So with that, why don't we dive into our conversation? I want to start first with just, even from some personal perspective, as a person who tried to exercise pretty regularly before COVID came and changed so much of what we do, I have not been able to do that now for the last few months, as I'm sure many people have. And there was a term that the two of you introduced to me recently known as deconditioning. And on its face, it may seem obvious, but can either of you or both of you share a little thoughts about what deconditioning is and how it affects people?
Absolutely. So let me take first crack at this. In terms of deconditioning, or in the athletic world, we call it detraining. But in essence, it's use it or lose it. And if you're not exercising, typically we'll lose cardiovascular fitness and then obviously the musculoskeletal system, so muscle and bone strength. And I think there's really three key things to take away from that. It's really the level of fitness prior to stopping, so that's really important. Number two, how long you were exercising prior to stopping. And then probably the most important is how long have you not been exercising. So I'll give you a quick example. Cardiovascular fitness disappears pretty quickly. Within a few weeks, you're able to notice a decrease in cardiovascular VO2 max. And so I encourage you to come by the lab and get this test done.
It's probably not good news for your buddy Luke here, actually.
But we can actually measure your cardiovascular fitness, putting you on a machine similar to putting a ar on a dyno measuring horsepower. And studies show within even 2 weeks, you'll see a drop-off in VO2 max. Elite athletes, who are the best of the best, if you will, after 3 months, will have a 50% reduction in VO2 max. So it gives you an idea of how much you can lose in terms of cardiovascular fitness. On the strength side, it takes a little longer. A month or two, you can start to see atrophy in muscle and weakness. So very important thing to consider. Injury of risk and obviously being deconditioned.
Yeah, I think it's just important to keep in mind that the higher you were going into it is where how far you may have fallen. And that when you restart, that you're going to see some deficits. And you will gain those back. It's just going to take you some time to get back on the horse.
Well, and I think that's the perfect segue into where I think we want the majority of our conversation to go today, which is, as we return to fitness, what can we expect from our bodies? What is reasonable to expect to make up some of those losses? So for either of you who want to start, what would you first expect or encourage people to think about when they say to themselves, all right, you know what, it's time for me to get back into the gym or to start exercising again in some way? Where do you want to go with this first? And if Dr. Martinez, if you want to start, then we can come to Dr.
So I think it's important to keep in mind that you're not going to be able to jump right back onto where you were before, assuming you've taken a 3 to 4 week hiatus. So if you've been off completely for 3 or 4 weeks, not doing any exercise at all, it's going to be very difficult for you to start at that level again. And that there's going to be a start slow and progress upward kind of process for you. that there's no magic bullet to this, just like when you first started exercising, there's no pain, no gain, right? You're going to have to exercise your way back to the way you were before. And then at that point, I would say listen to your symptoms, that you ought to be able to improve slowly but steadily, make improvements every few days. And then if you're not making slow and steady improvements in terms of your overall fitness level, that might be a signal that you have to be evaluated prior to continuing.
Dr. Martinez, what are you telling folks?
Great advice, Dr. Martinez. And I try to be a little prescriptive with the patients and give them an exercise prescription. So on our website, we've got a link out to some great information from the Strength and Conditioning Foundation. And they have a general rule called the 50-30-20-10 rule. And so a little complicated.
50-30-20-10.
But what we tell people in the first week, do 50% of your normal training load. And then the following week, it's a 30% reduction, then a 20% reduction, then a 10% reduction. So when you look at that, at the end of the 4 weeks, you're at 90% of what you were normally doing. And I think you can get there in different ways, whether that's the frequency of your exercise, the intensity, or the duration of exercise. But I think it's a fancy way of saying, as Matt said, start slow, get back to where you want to be. It's going to be a 4 to 5 week process. Don't jump into this thing full speed because you're going to get injured.
Well, yeah, I wanted to ask, what could happen? I mean, what's the downside of jumping back into this thing too quickly?
Injury is a big concern, and in our practice, that's what we're seeing, sort of this bimodal distribution. We're seeing the athlete that's coming in with cardiac questions that we're referring to Matt for, and we've got athletes that are coming in that are overuse injuries because either A, they have not been at work, and they haven't had access to a gym, so they're out there doing the same thing, running hour after hour, mile after mile. So we're seeing a lot of those overuse injuries as well.
From a cardiology standpoint, yeah.
Well, I think it ends up being the same discussion where you need to listen to your body, and that if you can start slow and progress upward, you're going to be able to overcome some of those challenges along the way. And then as you're going to hear about, I suspect in the next few minutes, that this is one of the methods that we're going to suggest that you utilize to determine if you need to be assessed or not. So if you've not had any infections over the last several months, then this is an opportunity for you to adjust based on your symptoms when you start to get back to your level of fitness.
The elephant in the room with everything we've been discussing over the last few months, of course, is COVID-19 and the impact that that's played on how we feel and how we're doing and how we are living our lives right now. And so I think there are a lot of folks who want to know, we talked about the time off and the impact that that has on your fitness, but what can folks expect, at least in terms of those who maybe have had COVID or weren't sure if they had it, or even those who haven't had it yet? How do we expect COVID-19 to impact our return to fitness and our return to play?
Well, I'm gonna leave Matt to talk about some of the details there, but I think it's important for the audience to realize that this virus affects multiple organs. And obviously Matt and I focus more on the cardiovascular pulmonary system, but I think it's important to realize that just like any virus, you're tired, you have decreased stamina, as we talked about deconditioning, but I'm most concerned about those patients who are symptomatic with a COVID infection, and then the high-end athletes or the weekend warrior returning with a potential cardiac issue. So it's really important for those patients to have an individual discussion with their physicians, their doctors, get evaluated if necessary, and ultimately see a cardiac expert like Dr. Martinez if there's any cardiac issues.
Yeah, and I love what you said about symptoms, right? So the disease is not uniform. We know that it affects folks in different ranges, and it can be asymptomatic. You didn't even know you had it. You got exposed and were completely unaware. You could have mild symptoms that you were able to be managed at home, and you could have pretty severe symptoms where we are now learning more and more that there is clearly a cardiovascular component and a pulmonary, obviously, component to this virus, more so than we've ever seen in viral infections.
Some of the questions that we're starting to get shared with us online are related to age issues. You know, is this different for younger student athletes than it would be perhaps for older weekend warriors or even older professional athletes, whatever gamut you want to run there? Are we seeing things break down differently at the student level than we are versus the adult level on the advice we're providing today?
Well, I think we don't know a lot about this disease, and as Dr. Martinez said earlier, this is a work in progress. Things are changing daily. I think it's clear, though, that at least in the younger population, they tend to be less symptomatic or asymptomatic. And so that becomes a little tricky when we're giving recommendations to return to exercise, because the vast majority of these younger athletes may not know that they've had this virus. And it's one of the reasons why the National Federation of High Schools and other organizations have really been diligent about asking screening questions to try to identify those high-risk individuals.
In fact, you mentioned briefly in one of your answers about some information posted on the web. If you want to read about any of the information we're going to talk about today, and I know that there are some resources that exist online for trainers and other folks, some of those screening questions you were just talking about, go to our website, atlantichealth.org, and you can find our sports health, all of our resources online there, where you can see some of those links and attachments there.
So let me expand a little bit, because most of our advice is being driven by very symptomatic and hospitalized patients. So that's where we have the most amount of data, although not a lot, to gauge kind of what our recommendations are. We are being conservative in this younger group because we don't have a lot of data, and we are collecting data. So we both work for the NFL. We're collecting what's happening in that organization, the NBA, Major League Soccer, that we consult with on what seems like a daily basis. We are also engaging that group to collect the data so we better understand not only who gets infected, but what happens when they do get infected. And then if you're older and you've got cardiovascular risk, you've got high blood pressure and diabetes or existing coronary artery disease or cardiomyopathies, like common diseases like hypertrophic cardiomyopathy, then that's an opportunity for you to be not only more mindful that you may be at higher risk, but to really engage your expert provider to get some specific recommendations about what you have.
We have a question that came in about gyms, and I want to get to gyms in a moment, but I first want to get to, I guess, the news of the week, if you will. NJSIAA has now started to, I guess, release some recommendations as far as return to play. And Dr. Martins, I know you've been particularly involved in that. Can you catch us up on what the current state of this reopening is as it relates to student athletics?
Sure, and obviously, again, as we said, this is a moving target. So I do encourage you to go to the NJSIAA website for the up-to-date information. I will tell you that sitting on that task force, they have been diligent and really taking the best information from the CDC, the New Jersey Department of Health, and the National High School Federations to come up with what fits in New Jersey. And I think a couple key points that I think are important here is that understanding that in this time of medical crisis, that a lot of these athletes who would normally be required to get their physical exam, what we in our world call the PPE, not personal protective equipment, but our pre-participation exam, the states have foregone that requirement as of now. And so obviously in a time of need, we felt very concerned about that and recommended adding some health history questionnaires. And so there are new additional questions regarding COVID exposure for all the reasons that Matt just pointed out. And the other thing that the committee's been working really hard on is really a phased approach to return to play. And so what was released on Monday from our committee was the phase 1 return to sports. And I'll summarize, but again, all the details are there. Then on July 13th, they're going to start phase 1, where you have small pods, less than 10 athletes, social distancing, more than 6 feet apart, for 90 minutes.
But this is groups of athletes together.
Group of athletes together. And this is non-contact conditioning, skills, and drills. This is not contact activity. So more to come as they roll that out. And I know that we get lots of questions from parents. I encourage them. There's an FAQ that's attached there that'll answer all of those questions for you. Are there differences in terms of the way different sports are going to impact certain kids, the way the concept of indoor sports versus outdoor sports? How many, it seems like there's a lot of variables around this issue right now. How much does that contribute to the complexity around this issue, and are all those factors being considered as we return to play here?
So I think it cannot be understated how complicated it is, that the more contact, the higher the risk. I love that we're separating, right, that we're making small pods or groups of folks for a lot of reasons. The first of which is that the less time you are exposed to another individual, then potentially the less likelihood that you are to contract it. And then in the event that someone in your group has that, the entire group doesn't go down as a result of that. So you're able to then isolate the one group and then try and figure out what happens in the other, because we are literally learning about this as we are treating it. So the more we can separate, and the sports that are more individualized are going to be very different than team sports.
Okay, so it could be like a tennis, or it could be like a cross country, or track and field, that kind of thing.
Correct. So if you're an NBA athlete, or you're a basketball player, you're a high school basketball athlete, one of the ways you're going to defend is going to be body to body. There's no way to separate that, and that's what the issue is with football as well. And then, of course, even other team sports where there may be more sort of individual aspects to it, like baseball being one of them, there's still a fair amount of contact that occurs. And, of course, you're sharing that baseball fairly often.
Batters and catchers are within proximity.
No doubt about it. Then the umpire right behind them.
Sure.
So that's really important to keep in mind, that each sport is going to be different, and you're going to have to really dig into whatever your potential risk is.
And just in terms of I know that there's no single answer to this one, but for parents, should they feel comfortable reaching out to the training staff, the coaches, the administrators? How important is communication in this process and making folks feel reassured about returning to play?
That's probably the most frequent questions that we get in the office from parents who are concerned. What should they be looking for? Right. In this time of year, it's a little complicated because as club sports are back, they're starting to engage the high school sports. Both the athletic trainers and the school nurses are not there yet. So much of this will rely on the coaches and administrators that are on the field to sort of help out. But if I was a parent, I would be asking, what are the screening that you're going to be doing? Are you doing screening questions? Are you doing temperature checks? Is there going to be social distancing? Will the coaches be wearing masks? Will you have hand sanitizers? Is there going to be shared equipment? And is there a plan in place? So if someone does have a symptom, what is their plan? How are they going to do this? Locker rooms, are they going to be open? Bathrooms, are they going to be shared? So I think these are all important questions that many of the organizations have addressed, but if you're a parent, you want to make sure that your individual team or school is addressing those issues.
I think you have to recognize that this is all going to be a slower process than we ever had before. Right. The separation by its very nature is going to require that it takes longer to do a practice. I am a parent and a coach, and what we've done is we've split up the groups as well, and it's taken now, instead of having a few practices, we're having more. And we're just starting to introduce some scrimmages and things to try and get back into that over the next several months.
What level of enthusiasm have you seen and heard about from parents who are looking forward to their kids participating? I mean, I know I'm not breaking any new ground here, but obviously people are very passionate about youth sports in this state and participation. What are you seeing in terms of a level of engagement from folks on this?
Yeah, I think the vast majority, if not 80 to 90%, have been very positive. How do we do this? But how do we do it safely? Right. There's a small portion that are concerned, and rightfully so, about is Johnny going to get infected if he goes to practice? Sure. And so walking through these are the policies and procedures that are in place. But I would say the vast majority of the parents are anxious to get their kids back out there.
Yeah, I think that's true. And I think the communication is critical. Because it's not only are they exposed, right, is that individual exposed, but they get to take that home with them. So depending on what your family story is, that's really important. So maybe you have an older loved one that lives with you. Maybe you've had a heart transplant patient that lives in your house, or a kidney transplant, or somebody else that's a higher risk. Each one of those students, it's not public knowledge, right? That's a conversation with the person that you trust involved in that team. And then that person can then decide what their potential risk is. What I've told my players and parents is that if you're uncomfortable, you should be respectful of that, and we're not going to share that with anybody. I think that's really critical.
Kenneth has a question regarding it. I just want to maybe reiterate something that you mentioned before. The PPE for fall sports. Has that decision been made to definitively waive that, or are they still looking into whether or not that's going to happen?
The task force has made that recommendation. They're still waiting for approval for that.
Got it. So that's not, so Kenneth, if you're listening, that is not carved in stone yet, but the recommendation has been made. Okay, let's pivot to the gym, because a lot of our audience are perhaps maybe heavily involved in fitness for themselves, or are looking to become, have improved fitness post-COVID. We know that gyms are not open yet, right? Governor Murphy has not lifted that restriction specifically as it relates to gyms. But when that does happen, if and when that does happen, what are some things for people to keep in mind? We touched on it a little bit about cleaning equipment and things like that, but let's really reiterate, for people who really love the gym and go every day, what would you guys start to recommend for them to consider? Or even gym owners as you look to reopen. What would you recommend?
So what I'm encouraging people to do is that if you can exercise outside, you should do that. If you can exercise at home, you ought to do that. But to your point, not everybody can. And that much like we heard about before, is that I would open that conversation with wherever you go and ask them what they are putting in place to help protect you when you decide to go back to an inside workout facility of a variety, right? Whether or not this is aerobic or anaerobic, CrossFit type things. And then the last is to take some ownership of your own, to make sure that you're engaged in that process. And what's that going to mean? That's going to mean that you should show up to the gym ready to exercise and leave when you are completed, that the congregating around locker rooms and that process where you're maybe using a shared water fountain type hydration system, it should be avoided. That you should bring your own water with you, you should bring your own towel with you, be prepared when you exercise, that you should clean your equipment when you arrive and clean your equipment when you are done. Everyone should really participate in taking some ownership over this process, even if you are really comfortable with your local gym. It's still all about you when you participate.
Some of that stuff isn't entirely new. I mean, gyms have been encouraging people to wipe down the machines and clean the machines for decades, right? For years. That's so it's more about reinforcing those existing public health guidelines. Is that a fair way to phrase it? Okay. Are we? Some of the folks who have followed up with questions ahead of our program, they're all sort of along in the similar lines, but maybe let's sort of, if we could provide I know there's a tiering system for individual sports, but we have questions about track and field, about soccer. Can we reiterate again for folks about, are there levels at which some sports are considered safer than others, or is that still sort of being defined?
Both the NCAA and the National Federation of High Schools has put out, again, on the website, put out nice information on the tiering or the risk stratification, if you will, of these sports. Obviously, where you've got close contact that can't be avoided, wrestling, football, that type of sport, they're considered high-risk sports, and they have their own phased approach of how they're going to do that. And then you can take what I consider low-risk sports, such as maybe golf or tennis, where you have obviously less physical contact. So each individual sport, we have laid out sort of a phase 1, 2, and 3 algorithm, but I encourage you to go to the website and sort of follow through that.
Yeah, even things like track and field. One of our folks asked about, are there things you can do in how you do the sport that will make you safer as you participate in it? And some of them seem more obvious than others, but I bet there's some things to consider there.
So lots of conversations about this. We just had a national conference about this past weekend, and really one of the world's experts on sports cardiology, Ben Levine, who's engaged in U.S. track and field, gave some great advice. And one of those was to maintain social distancing, but when you're exercising, you're going to double the distance. So if you're running, you're going to go 12 feet or longer. If you're cycling a little further than that, and then don't draft, right? So double the distance, how far you are from the participant ahead of you, and then try not to go right behind someone who's exercising, because you're literally right in their stream. So separation is still going to be critical even when you're exercising, but even more so.
As we look ahead down the line, I mean, obviously fall sports provide opportunities for outdoor sports. Winter sports, more complicated, right? So how, you mentioned this is a bit of a moving target. How much do you think we'll be revisiting this issue? How this guidance will be evolving as we change? I mean, do you think this is sort of we're just at the beginning of this process kind of thing?
We're meeting weekly on these things, and the policies, procedures are changing weekly. So I would say stay tuned.
Wow.
We are definitely not done yet, whether it's the high school level, the collegiate level, or the professional level. If you knew how much change has occurred in the last 6 weeks, I think you'd all be stunned, and you're going to see even more change in the next several months. We are absolutely meeting weekly or sooner, depending on how things happen. And you're going to see in the news, we're learning as we're going. So as schools go back, different sports go back, we're going to learn immediately about what their potential exposure is. And just getting the infection, meaning testing positive, we're still learning about what that's going to mean as well.
I get the sense that while there are obviously structural and significant differences between professional athletics, collegiate athletics, and academic level athletics like where we are here, it still strikes me that a lot of the same conversations are happening at all three levels. This concept of how you protect people. I think people might be surprised to learn that. Is that accurate? I
think it's fair to say that the issues that professional sports leagues are dealing with are very similar in terms of what the high schools are dealing with. How to deal with testing, how do you exercise with a mask on, and all those various things. And the weight rooms and the gyms, the touch points. You've got a lot of touch points that We've all been in gyms, and I'll say the gyms today are probably the cleanest they've ever been, but it's very hard when you've got shared equipment and a lot of touch points to decrease the opportunities for spread.
There's no question the questions are the same, the answers are different, and the resources are very different. Right. And what your exposure risk is when you are a professional athlete is different. How we can bubble you, that term bubble you've heard, whether inside the bubble or not, is very different when you're a high school athlete than when you're a collegiate athlete, and certainly when you're a professional athlete.
We're almost out of time, but just to leave folks with some broad takeaways here, then I guess we have a number of resources on our website, so I want to make sure we reiterate that. You and I, Dr. Martins, talked about some of those things that could go on there. There is, we have a screening document, which I believe is up there, which folks can see if they need some examples of what types of questions they should be asking of their athletes before they have folks come back. You mentioned the strength and training documentation that was on there as well. And Dr. Martinez, we have, I believe, a journal post that you were involved in writing that is on there as well. So we would encourage folks to definitely go on to our website and avail themselves of some of that information. And we can do our best to sort of share some of that stuff on social media too, so you can see it as well. For final takeaways, just in the broad sense, should folks be enthusiastic about sports returning here? I mean, I know there's a lot of folks who are concerned, and maybe their children were expecting a major senior year for them athletically with all the opportunities that come with something like that. Would you encourage folks to be excited about where we're going here, cautiously optimistic? Where would you leave it with folks?
I think it's fair to say, look, all of the physicians and the experts on these panels realize the physical, mental, and even immune system benefits of exercise. I think we're all trying to figure out a way to get everyone back in a safe manner. So yes, be enthusiastic. I think you're going to see sports happen. It may be very different. This is not normal times, so it may look very different, but I do think that we're going to get back to some level of sports and fitness in this state.
I'm just going to add to be patient, that this is a process that you may be frustrated with because it is ongoing and ever-changing. That recommendations we may have made 6 weeks ago are not likely to look like what they're going to be in 6 weeks from now, and that communication is going to be key, so there's going to be a lot of open communications from us talking about what those opportunities are, and then take some ownership, once again, that who you are determines what your potential risk is. And engaging in the process, we are absolutely available. And that if you have symptoms and you're concerned about them, that you should reach out to your medical professional. And that if you have existing cardiovascular risk, hypertension, diabetes, cardiomyopathies, that this is an opportunity to engage your local expert.
Excellent. Dr. Damion Martins, you are the Medical Director of Sports Medicine here at Atlantic Health System and a team physician with the New York Jets. And Dr. Matthew Martinez, you are the Director of Atlantic Health System Sports Cardiology Program at Morristown Medical Center. Thank you both for joining us.
Thank you.
All right, folks, and thank you for tuning in. We appreciate everybody who contributed questions and who followed along. If you have any further need of information, you can feel free to reach out to us via social. And again, if you missed any portion of today's program, you can see the whole thing on our thread in Facebook or on LinkedIn. And of course, you can see it on our website and News 12 Plus. I'm Luke Margolis, the Corporate Communications Director for Atlantic Health System. Thanks so much for joining us, and we'll see you next time.